Ladies and gentlemen, it's still Prime Morning and it's time for Good Living segment. I gave you a little bit as to what our conversation, our topic for discussion will be this morning, and we have to talk about the rise in HIV. I mean, the way cases are being recorded at the moment, my goodness. Anyways, my name is s3x Akumia. Get ready to be interactive with us on all our social media platforms. On Facebook, it is Joy Prime TV, but do not forget to hit the share button, or you can take our WhatsApp number 055-157-5757. I have seated with me this morning. It's lovely, and I'm excited to be here again today. She's in the person of Dr. Vanessa Apea. She is the CEO of the Accra London Health Centre. Good morning, Doc.
Good morning.
Good to have you again.
No, thank you for having me.
All right. So today, HIV/AIDS, National HIV estimated that over 15,000, just about 15,290 HIV cases were recorded in the year 2024, and 12,614 AIDS-related deaths happened last year. Very sad. But here's a different quite another alarming case when it comes to HIV/AIDS in 2025 at the moment. Well, again, National HIV is estimating that 42 cases are being recorded every day in relation to HIV amongst children and adults. So day in, day out, 42 cases, 42 infections. This is mind-blowing. So we are going to delve into that today on Good Living segment. So please get interactive with us. Dr. Vanessa, time and time and again, you would think that, we are doing so well when it comes to HIV/AIDS. There are some days, some years that you wouldn't hear so much about HIV/AIDS. But in this year, with the way the cases keep on coming, it's beginning to get alarming. And the question you would ask is, the advocacy is being done. Nurses, doctors are talking about HIV/AIDS here and there. What really are we doing wrong? What are we not looking at and tackling?
No, I think the figures are concerning. And whenever you see figures like that, what it tells you is that we have to intensify our efforts in terms of prevention, in terms of testing, in terms of treatment. And HIV is completely different to what we knew 20, 30 years ago, okay?
Yeah.
So we viewed HIV as an infection that was associated with death, and that was it.
Yeah.
That is not the case at the moment. We have not got a cure, but we have amazing treatment that allows people to have the same life expectancy if you're living with HIV as someone that is not living with HIV.
Why do you use the word amazing treatment?
Because the fact that so many years ago, when I first started training, not too long ago, I was working in a ward in the UK, and we would have a ward of 30 people living with HIV, advanced HIV, and all would pass away. We didn't have the right treatment there. We would lose everyone. Yeah. Now, if I lose one of my patients, I'm devastated, because that shouldn't happen, because we have highly effective treatment out there, which if we support people to have access and support them to take it as prescribed, they can live a long and healthy life and to thrive as well.
Okay.
Yeah, so for me, I feel it's intensifying prevention, testing, and treatment.
Intensifying. Let's talk about that. I want us to, start taking it one after the other and breaking them down. Okay, so intensify. How can we do that?
So first of all, I think one of the biggest challenges that we have with HIV is the stigma. So still. So there are so many people living with HIV that will not tell anyone. Their fear of how they're going to be received by family members and friends. And so for them, that allows them to then, forces them to live a dual life, And so they're out with their family and friends, they will know nothing. But then at home, they are so frustrated and upset with their diagnosis. And when you live like that, the living to take your medications every day, etc., sometimes you will lose hope and you'll be, okay, I don't want to do that. And when you don't take your medications regularly, that's when complications come.
Okay, before we delve deeper into medications, taking your medications, let's talk about the diagnosis. Now, I know for a fact that a number of people still do have this level of fear to get tested for HIV. And I know that, you know, before you get married also, one of the main tests that they will require that you do before you get married, HIV and, you know, all other tests. But there's still fear. People are avoiding. They're running from it.
The fear is still there, and it's the stigma related to it. And I think it's the lack of education, because as you say, people know a bit more about HIV, but if you were going on the street now and you are going to ask people, give me 5 facts about HIV, they wouldn't be able to tell you 5 solid facts or true facts about HIV. HIV is a treatable condition. Someone living with HIV and on effective treatment cannot pass it on sexually to another partner.
Could you please repeat that?
Undetectable is untransmittable. Someone living with HIV and on effective antiretroviral treatment cannot pass on HIV sexually to another partner.
Right.
And that is, you know,
although it's not curable.
Exactly, because we have amazing treatment that controls the virus, but that information just isn't out there. We have really effective treatment in terms of what we call pre-exposure prophylaxis. Okay. So if you are you're with someone and you're unsure of their status, or you know that they're living with HIV and you're unsure whether they're taking their medication, you yourself can take control. You yourself can take tablets every day, certain times before you're being intimate with your partner, and that will prevent you acquiring HIV. So we have really good treatment to stop you acquiring HIV. Okay. And then if you do acquire HIV, we've got really good treatment to enable you to live a long and healthy life.
To borrow your words, amazing. These are amazing medications for HIV, to contain HIV. I mean, what I'm thinking about at the moment is, okay, so you know somebody. Now, the way the treatment goes, you can't even tell like how we used to. Years ago, you would see, you know, the images, the videos that they would show on TV. Or when the moment somebody starts growing lean, you start suspecting them.
Exactly.
But then now you can't easily tell.
I say HIV has no face. You know, no, you cannot tell from the way they look, from the way they behave, that they're living with something that's affecting them. So what does that tell us? That tells us that we all as individuals have to make sure that we know ourselves, so we know whether we are living with HIV or not. And we know that if we are being intimate with people and we're not using protection, that there are other things that we should be taking to ensure that we remain HIV negative.
Okay.
And so carry on.
Yeah, so then I want to ask, at what point should that be the requirement for you to test for HIV?
So I would say that for anyone that is having regular, unprotected intercourse, I would say at least every 6 months. And at least when you change your partner. And and I say that because, you know,
my goodness,
we don't talk about it.
We don't.
And people are so... you know, it is fear, it's shame around intimacy and relationships, but it's important to know that we can take control and we can look after ourselves and make sure we have the opportunity to live our best lives, you know?
Yeah.
And so many people will, you know, only test like once, once every 3 years.
And then they feel, that's it, they are good.
You know, and you know, I don't even want to reinforce the language, but people use things like, I'm clean, you know, that's it. And, you know, again, that is stigmatizing language and it means nothing. What does that mean, you know? And so I encourage people that we need to know our status so that we can get the best care that we need, or we find the best support to make sure that we remain negative. And I think that's the crux of it all.
I love the fact that Dr. Vanessa has made us aware that HIV, although not curable, there are still amazing medications that can help contain HIV. You need to get tested every 6 months, especially if you are highly sexually active or if you change partners. I like that part especially. Anyway, so we want you to contribute to this on our social media platforms. You can go to Facebook. Do you have any interesting experience that you would want to share with us. Do you have any thoughts or opinions in relation to the resurgence of HIV/AIDS at the moment? You can share your thoughts with us on our Facebook page, that is Joy Prime TV, or you get the opportunity to call us via phone. We're going to put the phone number on your screen, so you call us and tell us your experience. If you have met somebody or if you know somebody who lives with HIV and maybe you have some concerns in relation to that, please do not hesitate to give us a call during this particular segment and let's get talking. Dr. Vanessa. Okay, so what else do we have to know in relation to HIV/AIDS?
So I reinforce, there's a really great activist in America that uses the term that everyone is HIV possible. You know?
Yeah.
And I love that statement because it recognizes that we all have a part to play in curbing HIV. So we have a part to play in making sure that we know our status.
Yeah.
We have a part to play in making sure that we support those that are living with HIV and remove that stigma. And we have a part to play in advocacy, in getting the conversation and the information out there and saying, these are the facts about HIV. Someone living with HIV can have children and can have children that do not have HIV. That's what the treatment does. And so I reflect, you know, I'm a positive person and I always use the term amazing and things like that.
Yeah.
And to me, as a medic, seeing the impact that it has made on HIV and the impact and the survivals, I'm excited about it. But I don't take it lightly.
Right.
Because anyone with any diagnosis, whether it's hypertension, whether it's diabetes, you tell someone that you have to take a tablet day in, day out, you tell them that they're living with something that they don't want to live with. You know, people don't want that. So I don't take it lightly. But what I do want to emphasize is that we have effective treatment out there that can help you to live life in the way that you want to live. And that is really important.
How symptoms of HIV/AIDS used to be years back, are we still going through the same?
We are, and it's a whole spectrum of things. So first of all, someone living with HIV may have no symptoms at all. So we say HIV has no face, but someone can be living without symptoms. There can be symptoms where, and I always reflect with people that they have been living with HIV for a while, they didn't know. And whereas they were functioning, you know, everyday life about 80%, suddenly that functioning drops to about 60%, 50%.
Okay.
But we compensate a lot. So, you know, and they just get on. And then when they start antiretroviral treatment, suddenly they get this Superman, Superwoman effect, like they get lots of energy. So they realize that actually I was, you know, going through a number of symptoms, but you may not realize it. The longer that you are living with HIV and it is untreated, that is when you will get more and more symptoms. That's when you get more and more other infections in the body as well. And then that can manifest into the classic symptoms that we associate with HIV and AIDS in terms of being really thin and cachectic, muscle wasting, some severe rashes and things like that. That is typically associated with more advanced HIV, which is untreated.
Untreated. You know, gone was a time when some Ghanaians used to think that even if you're to look at an HIV patient, you could get HIV. Like it was that bad years ago, you know, like 20 plus years ago and all of that. But then we thank God for innovations, we thank God for technology, we thank God for evolvement, the way we are evolving and everything. So we are evolving in all aspects. Please, I'm urging you to get interactive with us on our social media platforms. Dr. Vanessa Apea is here to answer all your questions for you in relation to HIV. The awareness needs to be pushed harder than already is. You would think that, oh, you know so much about HIV/AIDS, but there could be something that you do not know yet. And I love the fact that we have Dr. Vanessa Apea here and she's opening it all up for us. So if you have an experience one way or the other, you have a relative, you know, you've experienced something, please call in, share that experience with us. You could be helping somebody with that experience who is watching at the moment. So do not hesitate to call us during this particular segment. Now let's talk about HIV in children.
So again, when we think about HIV in children, so it's important to understand that someone living with HIV, a woman that is pregnant, and the virus is able to pass through the fetus, and then the child is born living with HIV.
Right.
If, number one, the mother is not on treatment, and if also, number two, if the child is born and they are not put on treatment as well. So what we do is that if we know that someone is diagnosed in pregnancy, we ensure that the mother is on treatment and on the right treatment, and then we also give treatment to the baby for a month once they're born. So there is a whole package of care that is provided when we diagnose women either before pregnancy or during pregnancy. Okay. We have a great pathway that when you are pregnant and you go to the antenatal clinic, you have your routine tests, and HIV testing is part of it. If you choose not to test, if you refuse and you don't turn up, or you don't go to your antenatal, that's when the certain complications can come. Because if we don't know that you're living with HIV, we can't support you and intervene. And again, I completely recognize that being pregnant and thinking about what that entails, fear, stigma, can be such a difficult time for women to even think about what to do. But the support is there. And if you take the treatment, you support your child to take treatment, they do not live with HIV. But there can be cases where, that isn't the case, and the child does acquire HIV. And we are seeing significant numbers of those children living with HIV as well. So once the rates increase in women, subsequently, if untreated, the rates will increase in children as well. So there's a lot of work to be done in terms of advocating for women and for children as well.
All right, ladies and gentlemen, well, did you know that over 77,000 people are living with HIV here in the Greater Accra region? If you didn't know, let's take a look at this.
The Greater Accra region tops the chart among all 16 regions with the highest number of persons living with HIV. Recent data from the Ghana AIDS Commission shows that the region currently has over 77,000 people living with the virus. Greater Accra not only leads in overall cases but also at the district level, where Accra Metropolis recorded the highest number of infections. Isaiah Doe is the Director of Research, Monitoring and Evaluation at the Ghana AIDS Commission.
Greater Accra, 77,821 out of the 334 or so people living with HIV. The greatest burden is on Greater Accra, and it's obvious. The urban centers. And it tapers, decreases at Northeast, 1,117. That's the list for the regions. So Greater Accra, Ashanti, 63,159, Eastern, 44,792, until Northeast, 1,717.
The data also revealed that over 18,000 children are living with the virus.
Now, children living with HIV, which we must look at it critically, because these are the future leaders of this country. We have 0 to 14, 18,229 children living with HIV and AIDS.
Present at the report launch was the UN AIDS Country Director for Ghana, Hector Sasila, who called on stakeholders to prioritize domestic funding to help close the gap created by the withdrawal of US aid support.
As you are aware, now we're facing globally challenges in HIV response due to the lack of funding globally, and this is also touching Ghana. So we need to try to make efforts to mobilize domestic funding.
In response, Acting Director General of the Commission highlighted that the Commission will now focus on domestic production of HIV care commodities.
Key highlights in this roadmap is the fact that we are going to rely mostly on the domestic production of the commodities. The commodities we mean the medications, the HIV medications, the condoms, the lubricants, and all.
Well, relying on Ghana domestically for the commodities needed, do we have everything we need? Are we well enabled, But I'm going to allow Dr. Vanessa to harness on that for us. When you say the commodities, what exactly are they talking about? But then before that, it's very alarming to find out that children between the ages of 0 to 5 years. Now cases are being recorded over 18,000. My goodness. Dr. Vanessa, I'm alarmed.
You're right to be alarmed, and it's also always painful when you see children affected by something that they have no control of. They have
no clue, no control. Mm-hmm. It's not their fault.
Yes, yeah. And, you know, and again, when we talk about it, I'm not quick to blame the parents as well. It's a complex situation, but it emphasizes to us that we need to create systems that supports women and their partners to test and to supports them to access treatment and to stay on treatment so that then children do not acquire HIV. So it's a big system approach.
Still speaking about children, what's the probability of a pregnant woman who is on treatment, you know, after being diagnosed of HIV, who is on treatment, passing or transferring the virus to her unborn baby?
So if the woman is on treatment and is on effective treatment, and what we say is the viral load is 0, so the level of the virus is undetectable, she should not pass the virus on to the baby. And to add to that, we also, as I said, we give treatment to the baby, antiretroviral treatment, to ensure that if there has been any passage, that everything is cleared and treated and suppressed. So with adequate treatment, appropriate treatment, we should be seeing no or very, very, very minimal cases of HIV in children.
Well, I'm encouraging you to send in your comments in relation to this topic. Let me read this one, and then we can continue. Dr. Vanessa, somebody is scratching at you. Okay, so good morning. Dr. Vanessa is drop-dead gorgeous. I'm Johnny Lante Vanderpoy from Tema. Apart from stigma, I think the cost of HIV treatment is a contributing factor to the lack of testing, hence the resurgence. How expensive or cheaper antiretroviral? Can stigma ever be eradicated? Okay, Dr. Vanessa, I want you to tackle the how expensive or cheap
so
it is.
Antiretroviral therapy, as it is provided centrally. So if you are living with HIV, sorry, my hair's my face. If you're living with HIV, then and you go to the treatment centres, you can access HIV treatment free of charge. You can access it from the clinics. Now, there are certain depending on certain complications or other treatment that's needed on top of that it may require some payment, but it's a centralized system in which we provide antiretroviral treatment free of charge. So you can access it, but people don't tend to go and they don't tend to keep on taking the treatment. But also, I think we have to be very honest as well. And as has been said by the Ghana AIDS Commission, there's a huge focus on making sure that we make more of the treatments in Ghana and be less reliant on external aid, because we've seen aid been taken away. Because the truth of the matter is that we do not always get all the treatment that we need at the right time, in the right volumes.
But the video, reports that we just watched, one of them did mention that globally, the resources that are needed, the aid that is needed globally for us to tackle HIV in the country is not there, and therefore they need to domestically acquire what is needed.
Exactly.
So we can't even rely on them globally or outside of the country.
We can't, and I really urge this because, you know, with all the withdrawal of funding from a number of the American sources, we've seen such a destabilization of HIV care and prevention. And that is so sad, because that should not be the case. We shouldn't be reliant on one or a number of series of initiatives that are funded by, one superpower, should I say. And so now what we've seen is that destabilization, when you're destable, it affects you in different ways, and it has a ricochet effect. And it gives a lot of people a lack of trust in the system as well. And so we're telling people to test. We're telling people that, come and take treatment. It's really good for you. We can support you to have a really good life. But then we've got a parallel problem that the people that were supporting all this infrastructure that we had, it's all broken away. So we have to, as a country, as a nation, really think about how much we need to invest to restabilize and support people living with HIV.
The regular Ghanaian would also say that if I don't think about it, if I don't get tested, I don't know whether I have it or not, and I'm living my life. I'm not even thinking about it, you know. And I kind of say that anywhere in your time.
Listen.
So they wouldn't even get tested at all, and they feel that they're okay. They are, you know.
It is. How can I put this? It's human nature.
Okay.
You know, we're all there. That if we don't know what you don't know doesn't hurt you,
Okay.
and so you're just moving on with life. But I always emphasize that at some point, if you are living with HIV and you are not on treatment, it will affect you. And I can't give you the dates, the times, you know.
yeah.
So I'm not going to be bogged down with those numbers, but I will tell you that it will affect you, and it will affect you in terms of your physical strength. HIV affects your immune system. So it affects the way that your body fights infection. So if it's affecting your immune system, it puts you at risk of everyday infections as well. So even more coughs and colds and other things.
Yeah,
but it puts you at risk of rarer infections as well. So increased risk of infections, increased risks of other disorders associated with HIV, some cancers as well. It affects your energy levels. It can also affect your brain function if it's untreated. So it will catch up on you. And I always say, why do we want to let it catch up on you?
Okay. So Vanessa, please hold that. We have a caller from Tamale. Hi, good morning.
Good morning.
How are you?
I'm fine. What about you?
Oh, we are doing awesomely well. Thank you for calling. Can we please know your name?
My name is Chesley, and I'm calling you from Tamale.
Okay. Do you have a question? Please go ahead.
In fact, I'm really shocked, or I'm very astonished for what I heard this morning.
Right.
Because, and I'm always asking myself, where are we getting that kind of disease? Is it from body sex? And I could remember when we were at school, where we have been taught that sharing of razor blades can also cause it, or we can also get it from that side. And are you sure that these aborted people, those who always move around or go in town,
Oh, the butchers.
are you sure that it cannot cause it?
Oh, okay.
Because whosoever call him or call them, if you have money to pay, they will come and cut your fingernails for you. So you, the Minister of Health, are you sure that that thing cannot cause HIV/AIDS?
I think we have to look at that. So we'll ask Dr. Vanessa about that as well. Is there any other question you want to ask?
Yeah, that's the question that I have.
Okay.
Because as a man, I know myself.
Right.
And I know that I'm not approaching to women. But I may be using that thing.
Oh, okay. Also, sometimes sometimes you call them to come and clip your nails for you, your fingernails, your toenails. Ah, okay.
But I'm talking to others. So me, I'm not doing that.
Oh, okay.
But many women, they feel lazy to buy razor blades and cut their fingers. And cut their fingernails.
Okay. Well, thank you so much. Thank you so much. Thank you.
So we should look on that side too.
Right. All right.
If it is not good for ourselves, and then we need to stop it.
Stop it. That's true. That's so true. Thank you. Thank you for calling us this morning. You could also contribute to this. Do you have any thoughts, opinions, questions in relation to the resurgence of HIV currently in Ghana? Dr. Vanessa Apea is here to answer it all for you. So, Doc, what his concern is, there are a number of men, some men and women, prefer, instead of going to this beauty spa, to get properly catered for, manicure, pedicure, they prefer the ones that are walking on the streets, and they'll call them, oh, come and clip my nails for me. And some will tell you that they even do it better than the spas, and it's cheaper. So his question is, with that being done quite often, could that one way or the other contribute to people acquiring HIV? Because a lot of the times, how would you know whether they sterilize their clips, the nail clips or not? How would you know? It's not like they could cut somebody, they could cut people and all of that.
Yeah.
So could that one way or the other also contribute?
So first of all, I'm so glad that he called in, because these kind of questions are the ones that it's important to discuss, because people have these thoughts. So first of all, HIV is transmitted through blood and other bodily products. So like semen, in vaginal fluid, but predominantly blood. And then we also recognize that there are people that use intravenous drugs, and with the exchange of needles that are not sterilized and they're passed between blood to blood, then we can see some transmission as well. We've also talked about mother to child through the placenta and the passage of HIV. So these are your main ways. Now, when we think of things like the cutting of nails or other things, HIV is like blood to blood, bodily fluid to bodily fluid transmission. So if you're cutting your nails, let's say, and you're using certain equipment, and the equipment may be dirty, but HIV as a virus on an object, it doesn't stay live on an object for long. You know? So when you know exactly why when we talk about, people say, oh, you can catch HIV from toilet seats. No, you know, and people think that if there's any fluid or someone living with HIV has got fluid and it's on the toilet seat, then someone else comes to sit on the seat, then it will be passed that way. No, you know, so it's HIV as a virus outside of the body and on what we call inanimate objects, so objects that are not alive, etc. It doesn't last long. So the risk of transmission of that is virtually
very low.
Exactly. So that's number one. Number two is that if we do see the exchange of blood to blood, there is a possibility there, but very, very low possibility for kind of small areas. So cutting the nails with a dirty,
unsterilized nail clipper.
Exactly.
Yeah.
You do not pass HIV on that way. But what I do say is that sterilization of anything that is used between people is incredibly important, because we focus on HIV, but there are other things and other just kind of infections and viruses that we may carry and we pass on. You know, we recently talked about COVID and you know the importance of washing your hands and using things. So there are things that we may pass on to each other just because that's the nature of the way that it's passed on. But for HIV, if it's about cutting your nails and using dirty ones, the risk of that is virtually zero. And when you're using any objects that are not sterilized, needles, the reason that it can pass HIV on is that a needle, which is dirty, can have blood in it, and then you are piercing the skin and you're going into a blood vessel. You're going, you're going from blood to blood. And that definitely...
Easy access, straight access.
Beautiful. That's exactly it. Easy access. But the risk of transmission from other sources in that way, in terms of nail clippers, virtually zero. And I should say zero. Let me just be clear. The other thing is that, you know, I say that protecting ourselves during intercourse is really important. But if you are living with someone with HIV and you're living with HIV and you have sex with someone unprotected, it is not guaranteed that you will pass HIV on that time.
How?
Because there's a number of factors related to you passing on HIV. So the amount of skin that may be broken during sex. So sex can sometimes cause what we call microabrasions, so little tears. And then that can facilitate, you know, from blood to blood into the body. Exchange of fluids, etc. But it doesn't happen 100% of the time. So that's why you can be with a partner and they're living with HIV, you're having unprotected sex, you don't know, and you go for a test and you're negative.
What about kissing?
No, you cannot pass HIV on by kissing. There is this notion of that, you know, when you share toothbrushes, etc. If on a toothbrush someone has got, when someone's got bleeding gums and they use a toothbrush, I do not advise you using that someone's got bleeding gums and you use that toothbrush and you pass it on, And I have to say, I do not advocate sharing toothbrushes at all.
At all.
I laugh about this in my house. With
not
my
even
kids.
when you're married.
Thank you.
Yeah.
So I'm saying that. This is one of my bugbears about it. So I say to my kids as well. So it's, you shouldn't be sharing toothbrushes anyway, but particularly if there are any bleeding gums, etc. But for kissing, no. Touching, hugging, using the same utensils, no. It cannot be passed on.
Our first caller mentioned something, using the same razor blades.
So, razor blades, in this thing, I never say never because it's the way that someone uses a razor blade. So if you're, you pick up, you're doing blading of your eyebrows or something, and there's no trauma to the skin. You're just getting the hair. You're highly skilled, so you're just getting the hair off. There's no tears in the skin. There's no breach of the skin. There's no exchange. I would never advise using dirty or an unsterilized between people, but the risk of that is negligible. If someone is doing it and there's multiple tears and there's a lot of blood on the razor blade, that's something different. So there's so many scenarios around with that. But the mainstay ways of passing on HIV is blood to blood, is exchange of bodily fluids, intravenous drug use, passing from mother to child if the person is not on treatment.
Beautiful. I have some comments. Let me read this one so we can continue. I want to know, is the figures based on tested and detected people or if a ratio? So the figures that we did mention to you earlier and the report that we showed you earlier on are just cases that have been reported. Only cases that have been reported. So if you see that and you think that you don't have HIV, or if you're quite scared, you get tested and then it turns out that you're positive, it's recorded. It is added to the already existed numbers. So imagine the ones that are not testing and are walking around. Can we go back to the message so I can finish reading that particular message, because I think he had a question in relation to that. But ladies and gentlemen, I hope that you've learned so much in relation to HIV today from Dr. Vanessa Apea. Okay, so we're trying to get some comments from Facebook as well so we can read it. But if you're watching us on Facebook, please get into the comment section right now and then send in your comments, and I'll definitely read them before the show ends. Ben Brain says, you people are not doing anything to stop the spread of HIV. You people only talk and count numbers. If you people really want to reduce HIV spread, introduce PEP tablets and injection at even drugstores and pharmacy and all drugstores. Condoms aren't helping. Okay. Duly noted, Ben. Thank you for that. Dr. Vanessa, you want to address that?
No, and I think it's interesting because, Ben, I can see you're passionate about it.
Yeah.
But the underlying ethos or reflection is I take it on board, because it is true that we can't just talk about it, we need action. But it is important that we talk about it. It is important that we count and we do surveillance,
yes,
but that we respond to it as well.
Yeah.
And again, the reflections there about making sure that people have access to treatment, making sure that people have access to pre-exposure prophylaxis to prevent them acquiring it. And the PEP that he mentioned is post-exposure prophylaxis. So if you have unprotected sex with someone or someone and then you are concerned, if you go to a clinic or the hospital within 72 hours, you can get tablets to prevent you acquiring HIV.
All right. So, Ben, we hope that, you've got your question answered. Okay, so let me read this one. Even Asari says, indeed, a lot has to be done to prevent the spread. More PR is needed across the country, not only in Accra. I have some questions. Is it true that people living with HIV can take medication and become non-reactive, meaning they no longer spread the virus? I think Dr. Vanessa did mention that earlier. She said yes. Also, Is it possible for one partner to have HIV and not transmit it to the other, even before they become pregnant? And she said yes in relation to that as well. Because the probability, you're thinking that, oh, if you're just having sexual intercourse with somebody who has HIV, you know, it will be so easy for the virus to be transmitted to you, is not true, because there are so many factors to the possibility of that happening. Please, I hope that you've learned so much. I have learned so much. It's an eye-opening for me today in relation to HIV. We need to reduce the stigma. We need to, in fact, we need to stop it completely. One person sent in a message and was asking the question that, can stigma be eradicated? Can it? Dr. Vanessa?
I would hope so,
right.
But there is so much work to do. You know, on July 21st is Global Zero HIV Stigma Day. And it's a reminder that globally, it's a call to action that we need to focus on HIV stigma. We need to challenge the mindset, the myths. And the myths is not anything to get annoyed with people about. It's everywhere. There's myths everywhere, but we need to challenge it and get the information out there that undetectable is untransmittable.
Okay.
All these facts are so important. Yeah.
Ladies and gentlemen, I have learned so much in relation to HIV with Dr. Vanessa Apea. It's been very informative. It's been, educative as well. So, Dr. Vanessa, thank you so much for your time this morning.